This will be a demonstration on Foley catheterization of a female. This is an invasive technique. You want to make sure that you have a doctor's order for this procedure so that you're also able to explain to the patient as well why it is that they're going to have this procedure done. You're going to go ahead before you go into the room and gather your equipment. You're going to make sure that you have a Foley catheter kit. These kits are usually all-inclusive. They have your gloves in here, your lubricants in here. Almost everything you need for the procedure should be inside. When you go into the patient's room, make sure you have some clean gloves, which are usually inside, so that the first thing you want to do is to check your patient, make sure it's the proper patient, but you also want to check the area that you're going to be doing the procedure on. I'm going to go ahead and have my assistant help me and drape the patient here so I can take a look at their peri area. I'm going to go ahead and I've already washed my hands. I entered the room. I'm going to put on my clean gloves, and I'm going to check the perineal area here to make sure that it's clean. If there's been any kind of bowel movement or excrement here, I can go ahead and clean my patient appropriately, like you learned for ADL care, top to bottom. And as I'm doing so, I can also look at the anatomy and see how your urethra is and see how easy time I'm going to have with my procedure. I'm going to go ahead and take off my gloves. I will wash my hands again, and I will go ahead and get ready for my sterile technique. I'm going to make sure that the patient's privacy was already maintained by having the curtains closed. Yes, so if you could put the bed up for me, please. I'm going to go ahead and just keep the patient covered, but I'm going to lower the sheets down here so I can maintain an area that I can put my trash as I'm doing the procedure. I can either use a plastic for my bag, or I can use a blue check sheet for any kind of wet discard I would like to do. I have my patient in an appropriate position, which will be in like a frog-like position with the legs up, much like they're having a gynecological exam. My assistant will help to remove the gown when it comes time. I've washed my hands. I'm going to open up my sterile kit. Each kit's a little bit different, but how it comes will guide how I'm going to open up my equipment. I'm going to always open up sterile technique away from me, away from me, away from me, not touching that 1-inch border. That is sterile technique here. And I'm going to go ahead and see what this kit has in order for me. My drapes are on top here, so I'm going to go ahead and just grab this top drape. Whatever side I touch is the part that's going to be non-sterile. So since I've touched the outer corner here, I'm going to go underneath, have the assistant undrape the patient, and I'm going to put this underneath the patient's bottom here. I'm going to go ahead then, and next on top will be my gloves. I'm going to just pinch this top part of my gloves, again, just like we did before. I'm going to make sure I have a nice dry area to open up my gloves, right and left. Sterile gloving we went over in an earlier procedure. I'm going to go ahead and put on sterile gloves. Okay. And then now that I'm sterile, I can go ahead and assemble my kit here. The fenestrated drapes, most people do not tend to use because it tends to get in the way during your catheterization. I have my tube here filled with saline to inflate my balloon, to check my balloon. And again, I'm trying to not go over my kit, so I'm going to move the kit around as I need to. I'm going to test my balloon here. Some come with a little sheet on it to see, you might need to remove the blue sheet over your catheter. I'm going to inflate my balloon, make sure there's no leaks, withdraw that fluid from it, and I'm going to leave it inside of my kit here. I have my alcohol betadine strips here, which I'm not going to use on my mannequin, but I would tear those open and have those ready to go. In here is also my lubricant. I'm going to open up my lubricant, and I'm going to squirt it onto a paper here so I can easily glide it into. Some kits have more of a tray-like, so it's easier to kind of dip into it. I'm going to pretend that I have my alcohol, my swab sticks here ready, set to go. I have been sterile. Now comes a sterile and a cleaned part of the technique. This hand is going to be non-sterile. It's going to be just clean. I'm going to open up the labia here, and I'm going to take my swab, one swab at a time here. I'm going to swap from top to bottom, first going from the side away from me, top to bottom. I'm going to discard, next swap, top to bottom, discard, next swap, straight down the center, top to bottom, and discard. This hand is still sterile, that hand is clean. I'm going to take my catheter here, I'm going to lube it up, and I'm making sure that this hand is keeping the labia open here so I'm not ruining the sterile procedure here. I'm going to take my kit, I'm going to drop it on my sterile area here. I'm still sterile here. I'm going to go ahead straight inside the urethra here, applying just gentle pressure as I advance the catheter until I see urine flow. I'm going to advance 1 to 2 inches more. I'm going to hold here. I'm going to ask my assistant if she would please fill the balloon up. And on my catheter here, it says how many cc's of water, which is 10 cc. She's filling up 10 cc's in that balloon. I'm going to gently pull back till there's resistance. Urine is flowing in the tube here. And we're going to take this and put it below the level of the patient. And we're going to attach it to the catheter. And we're going to let the patient's legs go down to help her relax. Catheters come in most kits. It has a little tree here. And you can attach it to the patient there. Put this over the side of the patient. Inside your kit here, you want to make sure you do not touch the inside of that collection tube. You can use that as a sterile specimen. And we'll show you on class how to put this on a proper area of the bed. Put your patient down to a proper position. Clean them up as you need to. Cover them up. Remove your gloves and reassess your patient. Documentation as always.